So whenever you enter into a fellowship, it's that next level of training. It's something where you're building on experiences that you had in residency, and okay, now learning from kind of the masters in joint replacement. With differences in fellowships, of course, there's big names with every fellowship. This one has been unique in the fact that these are some of the pioneers. The names speak for themselves, and those introductions, those sort of experiences, I don't know if I would have had other places.
I think you get taken aback early on, but after being with them for about a year, you feel very comfortable. They're friends at this point, and not only mentors. And so building that relationship through kind of compressed time with them for a year has been very, very beneficial and instrumental, I think, in moving forward. It's been a really good year. What I've wanted from this is high volume and getting to learn a lot of new things, see some hard cases as well as a lot of primary joint replacements. So it's been very beneficial.
Of course, by the end of residency, you're basically in the 27th grade. By the time you're done with your fellowship, you're definitely ready to make all the decisions. And at this point, it's practice management, how to run a clinic efficiently, working with your MAs, your staff, surgery scheduling, coordination with surgery staff, as well as implant choice. So there's a whole lot more that kind of comes into your decision, and that's gradually grown over the year without us really even noticing it.
The big progression, I think, is not just them allowing you to do the handheld skills stuff, but now trusting you a little bit more on your decision making intraoperatively. Dr. Morey's, and especially I think from the Mayo lineage, a minimalist approach, not trying to overcomplicate a very complicated thing already. You can really get bogged down in the weeds and make something complex look complex, or you can make something complex look simple, and that's sort of what we try to do.
From a joint replacement, hip and knee specialty, I'm more comfortable than I've ever been, and more efficient in the operating room than I've ever been. It's been a great opportunity to be able to take care of people, and you'll be able to take some of those same practices that I've learned over this year and incorporate them into my future practice.
I think I'll make a lot of mistakes coming out, but I'm gonna make a lot less than I would have if I wouldn't have had this fellowship. So those are the big things that I think are sort of, like I said, indispensable about spending the extra year. I know everybody wants to get done after 4 years of medical school and 5 years of residency, but taking that extra year I think is pretty pivotal to you, your career, and your patients.